Hello, students of speech language pathology. You must have had your classes and practical sessions on the aspects of cleft lip and palate as per the curriculum. I am presenting to you a self-review module that aims to help you revise the perceptual assessment of cleft speech sound errors. Before we go into the details of each error, allow me to give a brief introduction to the condition of cleft lip and palate. A cleft lip and palate is a congenital condition wherein abnormal opening is seen in the lip and palate that in a normal condition would ideally be closed. In other words, the structures do not fuse together normally despite being present. Now, it is not necessary that all children with CLP will have a cleft both in the lip and the palate. Some individuals are born with a cleft just in the lip or just in the palate. A cleft lip is a condition that occurs when parts of the lip fail to come together early in the life of a fetus. Whereas a cleft palate occurs when sections of the roof of the oral cavity don't fuse normally, which results in an opening between the oral and nasal cavities. Associated problems with a cleft lip condition, among others, are more related to cosmetic concerns, while those in a cleft palate condition are more related to difficulties in feeding and deficits in speech, language, and hearing. A cleft can either be unilateral or bilateral. Now, while assessing articulation, it is important to determine whether there are any speech sound errors or distortions. It is also important to identify the type of error. So it could be a placement or a phonological or developmental error. When there are structural anomalies, it is also important to determine whether there are any compensatory errors or obligatory distortions. Compensatory articulation errors are those that occur in individuals with cleft who have associated velopharyngeal dysfunction. In such situations, the manner of production of the sounds is maintained. That is, a plosive will be substituted by a plosive, a fricative will be substituted by a fricative. However, the placement of production is moved posteriorly in the oral cavity or to the pharynx or larynx. In addition, sometimes the direction of airflow is changed from oral to nasal. Compensatory errors include glottal stops, pharyngeal plosives, pharyngeal fricatives, pharyngeal affricates, generalized backing, mid-dorsal palatal stops, posterior nasal fricatives, velar fricatives, and nasal sniff. Such errors can be rectified only and only through speech therapy. Moving on to obligatory errors. An obligatory error is one where the articulation placement, which resembles the function of the articulator during sound production, is maintained. So it's normal, but the abnormality of the structure causes the distortion of speech. For example, when there is a large velopharyngeal opening, the placement of articulator may be normal, but the manner of production is altered from oral to nasal due to the lack of velopharyngeal closure. As a result, voice plosives may sound closer to their nasal complement. That is, b may sound like m, d may sound like n, g may sound like ng. Obligatory errors include nasalized phonemes, nasal air emission, and weak pressure consonants. These errors can be rectified only through physical correction of the deformity, which may be either through surgery or through the use of a prosthesis. Let's move on to the explanation of each error. Before proceeding, however, I would like to mention that this module doesn't include all the compensatory errors that were previously mentioned. The reason being that such errors differ from language to language. Since the samples used in this module are only from the Marathi language, only those errors that are commonly identified in this language are included in the module. So beginning with glottal stops. A glottal stop is a plosive sound that is produced by the adduction of vocal folds followed by a buildup of air pressure in the subglottal region, which is followed by a sudden separation of the vocal folds to release the pressure. This results in a grunt type sound, which typically sounds like this. The production of glottal stops can be seen as an increased activity in the laryngeal area. Because this air pressure is released at the glottal level already, the need for velopharyngeal closure while speaking doesn't exist. Hence, glottal stops often appear to be associated with a significant velopharyngeal opening, which may also make the speech sound nasalized in nature. When there is a significant EPI, glottal stops are often substituted for plosive sounds, but they may also be substituted for fricatives and affricates, especially if the child has not developed the fricative manner in his or her phonemic repertoire. Appreciate the difference between the typical production of plosive sounds p, t, and k and that of a glottal stop in a condition of cleft, where there is a buildup of air pressure here and a sudden release through the opening of the vocal folds, producing the grunt sound. Typical sounds that are substituted include p, b, t, d, t, d, k, and g. The IPA symbol for the glottal stops, as you can see, is similar in looks to that of a question mark. Let's listen to these samples on this slide that represent the error. The target production of these samples are transcribed in the IPA and also transcribed using the IPA symbol of the error as produced by the child with a cleft palate. Kindly note though that every sample may have multiple forms of errors present. But while reading about the individual error, I would like you to focus on the specific sound associated with the error in each sample that you listen to. Playing for you the first sample.
Sample 1, target sentence, Kaku, Kakadi, Ta.
Here you can see that sounds like k in kaku and kakadi, and tak as well as the sounds t in tak are all substituted by the glottal stop, which sounds like a in its production. Now hear the sample again for a better understanding.
Sample 1, target sentence, Kaku, Kakadi, Ta.
Playing for you the second sample.
Sample 2, target sentence, Taksani, Sataivar, Ahe.
Taksani, Sataivar, Ahe.
Here the sounds t in tatsani and satai as well as s in the same two words are substituted by the glottal stop, making it sound like a in its production. I shall play it again for a better understanding.
Sample 2, target sentence, Taksani, Sataivar, Ahe.
Taksani, Sataivar, Ahe.
The next error for review is nasal air emission. Nasal air emission occurs when there is an attempt to build up intraoral air pressure for the production of oral consonants while there is a leak in the system, which could be due to either a velopharyngeal dysfunction or due to a oral nasal fistula. As a result, some of the airflow is released through the nose, causing a disruption in the aerodynamic process of speech. You can see in the diagram here how sounds are normally produced in the absence of a VPD, and in the second picture here, how due to inadequate closure of the velopharyngeal wall, airflow is released into the nasal cavity out into the opening. Nasal air emission occurs on pressure-sensitive phonemes which are plosives such as p, b, t, d, k, and g, and fricatives such as z, f, v, sh, and affricates such as ch and j. It is most noticed on voiceless phonemes because they are associated with more air pressure than their voiced counterparts, where the adduction of the vocal folds attenuates the air pressure. Nasal air emission often occurs with hypernasality, but can also occur with normal resonance. A typical nasal air emission sounds like this. This is the IPS symbol of the error. The symbol is used as a diacritic on the sounds that are affected. Let's listen to these samples on the slide that represent the error. The target production of these samples are transcribed in the IPS and also transcribed using the IPS symbol of the error as produced in the utterance by the child with a cleft palate. As before, I would like you to focus on the specific sound associated with the error in each sample, even though there may be multiple errors. Playing for you the first sample.
Sample 1, target word, receiver.
Here you can observe that the clear release of air is present in the form of in the utterance. You may appreciate the error once more by listening to the sample.
Sample 1, target word, receiver.
Playing for you the second sample.
Sample 2, target word, sankat.
Here you can observe the emission of air during the production of s in sankat. Playing it once more for you.
Sample 2, target word, sankat.
The third error, generalized backing. This error occurs typically when the back of the tongue pushes against the velum or against the posterior pharyngeal wall. This causes air pressure to impound more at the back of the oral cavity. In the presence of a VPI, the tongue pushes the velum upward to help in its closure. As you can see here, sounds like t, t, d, and d, which are normally produced by the tongue tip, are substituted by a backward production, making these sounds like their voiced and voiceless cognate. So t may sound like k, while d may sound like g. Generalized backing is generally seen for sounds produced at the front of the oral cavity. These may be p, b, t, d, t, and d. As such, there is no specific symbol for generalized backing. The back sounds that substitute the front sounds are written in their original IPA. Playing the first sample in this slide.
Sample 1, target sentence, Dadu Dora De.
Nagu Dorage.
You would have noticed that the sound the in the entire sentence was substituted by g in all its different positions. We shall hear it once again.
Sample 1, target sentence, Dadu Dora De.
Nagu Dorage.
Playing for you the second sample.
Sample 2, target sentence, Tiru Tat Vati De.
Tilu Tatwatige.
Here you would have observed that the sounds t and t were substituted by k wherever they were supposed to be produced according to the target sentence, as well as the sound d in the last word was substituted by the sound g. Let's hear it once again.
Sample 2, target sentence, Tiru Tat Vati De.
Tilu Tatwatige.
Weak pressure consonants. This error is commonly seen to occur for pressure consonants. Pressure consonants are those that require the palate to close to the back of the oral cavity, thereby blocking the nasal passage. When air is leaked through the velopharyngeal valve, the airflow release available in the oral cavity, which is ideally required for the production of consonants, is reduced. This causes the consonants to be weak in intensity and pressure, or to be omitted completely. There is an inverse relationship between nasal emission and oral airflow. Therefore, the greater the nasal emission, the weaker the consonants tend to be. Hence, a child displaying nasal air emission in his or her speech may also produce consonants that are weak in pressure. Sounds that are substituted are those that may be affected, which may be p, b, t, d, g, g, f, b, s, z, sh, j, and ch. There is no specific IPA symbol to represent this error. Let's listen to the samples on the slide that represent the error. Kindly note that the articulatory placement of the sounds in this sample may be correct. The difference is seen in its intensity or pressure required for its precise production. Playing for you the first sample.
Sample 1. Target sentence. Dadu, Tora, De.
Nanu Norane.
You will notice here that the speech sounds nasalized in nature, yet pay closer attention to the phoneme D. It is produced well, but it lacks precision and clarity. I will play it for you once again.
Sample 1. Target sentence. Dadu, Tora, De.
Nanu Norane.
Playing for you the second sample.
Sample 2. Target sentence. गुलाबी रंगाचे गुलाब महाग होते.
गुलाबी
Rabi.
रंगाचे
Ramate.
गुलाब महाग होते.
Note here that sounds like G, B, Ch, and T all lack precision and clarity in the sample. Listen to it once again.
Sample 2. Target sentence. गुलाबी रंगाचे गुलाब महाग होते.
गुलाबी
Rabi.
रंगाचे
Ramate.
गुलाब महाग होते.
Nasalized phonemes. Nasalization of oral consonants occur due to the presence of hypernasality, which in turn occurs due to a large velopharyngeal opening. When voice plosives are produced in the presence of a significant VPI or a large oronasal fistula, these oral phonemes sound more like the nasal cognates. So B will sound like M, D will sound like N. Let's listen to the samples on this slide that represent the error. Playing for you the first sample.
Sample 1. Target sentence. Dolly, Vada, Pad.
Noni Ona Pand.
Here, while the individual phonemes are correctly articulated, you will observe that the speech as a whole is nasal in nature. I shall play it for you once again.
Sample 1. Target sentence. Dolly, Vada, Pad.
Noni Ona Pand.
Playing for you the second sample.
Sample 2. Target sentence. Tiru, Tat, Vati, De.
Tillu Tat Watine.
Again, you would have observed that the articulation remains intact in terms of its precision and intensity of production. However, the overall speech is perceived as nasal in nature. I shall play it a second time.
Sample 2. Target sentence. Tiru, Tat, Vati, De.
Tillu Tat Watine.
Moving on to our last error, a posterior nasal fricative. It is usually voiceless and is produced by elevating the back of the tongue so that it articulates against the velum, as in the production of a ng sound. As the air flows upwards through the pharynx, the back of the tongue blocks the entrance into the oral cavity. Therefore, the air is forced through the closed velopharyngeal valve, causing a small opening. This production results in a very audible nasal emission called a nasal rustle, which is turbulent and noisy in nature. It is similar to nasal air emission in the sense that air is emitted out of the nose, but the difference lies in its noisiness of the emission, which is a characteristic feature of a posterior nasal fricative. The posterior nasal fricative may be used as a substitution for any of the pressure-sensitive phonemes, but it is typically used for sibilants. Hence, sounds like s, z, sh, zh, j, and ch are affected. This is the IPS symbol for this error. The symbol is used as a diacritic on the sounds that are affected. Let's listen to these samples on this slide that represent the error. Playing for you the first sample.
Sample 1. Target word. Exert.
Exert. Exert.
The noisy or turbulent sound of the nasal rustle is very evident on the sound s in the word. I shall play it a second time.
Sample 1. Target word. Exert.
Exert. Exert.
Playing for you the second sample.
Sample 2. Target word. Basust.
Basust.
Again, you will note the noisy or turbulent nasal rustle on the sounds s and sh in the word. Listen to it once again.
Sample 2. Target word. Basust.
Basust.
Certain points to note. Correct identification of these errors is crucial to decide on the most appropriate form of treatment. Treatment of compensatory errors can be carried out only through speech therapy. Treatment of obligatory errors first require a surgical or prosthetic intervention. Therapy does not involve routine approaches for correct articulation, such as phonetic placements. On the other hand, every cleft speech error has a unique management technique. Surgery or other medical treatments is not the solution to rectify compensatory articulation errors. Lastly, only a certified speech-language pathologist trained in the management of cleft lip and palate can provide therapeutic services to this clinical population. This brings me to the end of this module. Thank you for your attention. Have a good day.